talking about colorectal screenings. And it was a young lady. She was like 40, 42. And at that time, the age limit hadn't been dropped yet. It was still 50. And she didn't have a history that she knew of. So family history is very important. You need to know what's going on in your family. And we were just talking, and she was saying, I've been having this GI upset. It comes and it goes. I think it's just stress, or, I have a lot of life changes that are going on. So we just started talking, and she was having, heartburn, and she was having diarrhea at times, and, pain. And she wasn't seeing blood on her stools, but she was having the symptoms that were a little worrisome. So I told her, your best bet is to really go and talk to your primary care doctor. I said, just let them know what's going on. So she ended up calling me, I want to say 3 or 4 months later, and she had talked to her primary care doctor. She talked to her parents and found out that they had colorectal cancer in her great grandmother on her father's side, her great grandmother on her mother's side, and her grandmother on her father's side had colorectal cancer. So, because she had that family history, automatically she was able to get screened. And normally, what they'll do is they want to know the age of diagnosis for your whoever your family is, so that way they can start 10 years early. So her grandmother was diagnosed at 55. So she technically could start right now getting screens, and that's what she did. She ended up getting a screen, and she had stage 1 colorectal cancer.